back to Medical Monday. If you're just joining us, thank you. I'm here with Dr. David Gnewikow from Advanced Hearing Solutions in Mount Juliet. We're talking about hearing loss and how to remedy that. We've had some great callers, and the lines are open right now. 615-737+ is the number to call. All right, I want to talk a little bit more about these hearing aids.
Okay.
You're not a particular fan of one company over the other per se, just as when it comes to how they work. It is a big investment, and hearing aids have come a long way since we were talking about our grandfather's hearing aids where you tuned them and they squealed. What are some of the crazy features offered now?
Okay, so there's an app for that. Sorry, that's a bad joke. But probably one of the biggest changes in hearing technology over the last 10 to 15 years has been the incorporation of Bluetooth.
Okay.
So Bluetooth is a crazy name, but if you don't know what that means, it just means it's a way to wirelessly connect one device to another. Just like I can connect my phone in my truck, or you can connect your phone to a printer, or whatever. It's a wireless connection. So what we can do with hearing aids now is we can connect your phone to your hearing aids. We can connect your hearing aids to your television. I can connect your hearing aids to a remote conference mic that you can put on in a meeting, and it'll seek out. So that wireless ability lets us be able to do so many things that we could not do before. For example, we talked about the phone. If I pair my iPhone with my hearing aids and I want to answer a call, depending on the brand, some of them have a little streamer, but I can just push a button and say hello. I'm talking through the microphone of my hearing aid. I can literally talk with nothing, no phone, and be able to carry on a conversation, and that audio is coming directly in the ears. And that's nice from a convenience standpoint, but it's even more important from a hearing standpoint, because if you take your phone and you crank the volume all the way up, you're turning the sound up, but you're not necessarily compensating for your prescription of your hearing loss. It's like turning the lights up, but you don't have the right lenses on your glasses. And so what we do with the hearing aids is, when you're on the phone, it's using your hearing loss prescription. When you're listening to television through Bluetooth, it is using your hearing loss prescription, not just cranking the volume up. That's a big misconception with hearing aids. When I get hearing aids, everything's going to be loud. Wrong. If they're fit right, everything is not loud. Everything is clearer, because we're giving you back those sounds that you haven't been hearing. So Bluetooth is a big one. Rechargeable is also kind of a big advance, especially in the last year or so.
So you're not buying all those batteries that are very expensive.
So that's one of the big kind of stigma about hearing aids, is the guys always changing the batteries and they go out at the most inopportune moment. And there have been some rechargeable options on the market, but about 2 years ago, companies started introducing hearing aids with a lithium-ion battery, which is the same type of battery that go in cell phones. 5-year battery life. You can charge it for 2 to 3 hours and wear it for 24 to 30 hours. So very user-friendly. The cases are sealed, so you don't have to open and close the battery door. So then you've got something that's more waterproof. So rechargeable has been really big in our practice over the last year or two. And I've taken people who've been wearing hearing aids with batteries for 20 years and just go, oh my gosh, there's finally a solution where I don't have to go to Walgreens and buy those batteries and peel the little stickers off. And I mean, battery hearing aids are still fine. I'm not saying that's wrong, but that's certainly an advancement. I guess the other would just be miniaturization and comfort.
Yes.
So I wear a hearing aid. You probably won't be able to zoom in, but I have a little hearing aid that sits behind my ear. It's almost impossible to see, and I don't have any hair to kind of camouflage it. This is what's called a receiver in the ear, or an open fit hearing aid. And so people are amazed when they're used to thinking what their dad had or what their granddad had, and they come in and they say, you mean you can make me hear with something like that? You know, people are very impressed with that. So although I won't say cosmetics are not important, we all care about what we look like. But to me, the size thing a lot of times is more about comfort, because it makes it so I don't have to cram a big plug in my ear. I don't have to, you know, do this big molded thing. I can do something that's small and comfortable that very few people can see, but that I don't even know I'm wearing.
Okay, I'm going to go to the lines right now. We have Virginia on the line. Virginia, thank you for calling in tonight. What's your question?
Yes, hi. You have a person on the line using sign language.
Oh, fantastic.
And who was saying, how do I get a cochlear hearing aid?
Okay.
I need another one.
So she's talking about a cochlear implant.
Right.
So cochlear implants are a very good technology. They are primarily for people who are severely or profoundly hearing impaired, people for whom hearing aids are of pretty limited benefit. I won't advertise for anybody. We don't do anything.
Yeah, so now I don't, with a hearing aid, I don't hear anything. I'm deaf now.
Right, and so that probably puts that person, of course we'd have to test them to know, but that probably puts that person in candidacy for a cochlear implant. There are several practices in Nashville, I won't advertise for one over the other or I'll get in trouble, that specialize in that. I will say Vanderbilt is very well known for that. That's where I spent a lot of my time. That have audiologists and doctors who pretty much exclusively do cochlear implants. And a cochlear implant doesn't work like a hearing aid. A cochlear implant is actually an electrode or an electrode array that is threaded into the inner ear, and then they have a little device on the outside that's basically a computer. Picks up the sound, changes it to electrical energy, and sends it directly to the nerve. That's right. There is still, though, for cochlear implants, and this is a little bit of a misnomer or a point of confusion for people, with cochlear implants, there is still an external device. So the electrode array is permanent, it goes in, fits underneath the scalp with a little magnet, but there's an external device that is a processor that connects to that magnet. So I've had people come in and go, well, I heard about the implant, I want the one that's implanted that no one can see, but a cochlear implant's actually not that. There's part of it that's implanted, but there's part of it that is external.
So if Virginia stopped working, is that a problem with the external device?
Most of the time, well, now I think she was saying she had a hearing aid and a cochlear implant. Most of the time, if the cochlear implant has quit working, it is the external device. So I certainly would say it's worth going back to wherever you were fit with that and having them check it, because sometimes it's
there's a cochlear on the right.
Yes, okay, so sometimes it's as simple as, I had a patient today with a cochlear implant that said she quit hearing, and she's like, oh well, I'm going to give up, and they went back and cleaned a microphone or did something, you know, with that actual device, or sent it in for a repair and got her cochlear implant back working. So it may not not be, Virginia, that you actually need a whole new cochlear implant, but that a repair could be done on what you already have, or something might be able to be serviced.
Hopefully that helps. Does that help?
Right, but I don't have it.
Okay.
I don't have it.
So
so hold on one second. Let me get some clarification.
Sure.
Yeah, so I need the outside part. That's all I need. Yeah, the inside is there. It's fine. I just need the outside part.
So you definitely don't want to go through surgery again if you don't have to. No, it's not a terribly invasive surgery, but you don't want to do that. But certainly that part can be replaced. So I would either go back wherever you were fit with that. Again, Vanderbilt, Nashville ENT is another place. Again, I won't get in trouble if I keep naming names, but there are several places in Nashville that actually do that.
All right, Virginia, thank you for calling in, first of all, and good luck with all of that. I can imagine what a life changer that is.
Sure, absolutely, especially for people who have, they've heard and then they lose their hearing and get it back. I mean, it's an amazing experience.
We've all seen those YouTube videos, especially of the children who hear mom's voice. I could just cry thinking about hear mom's voice for the first time, and they just start clapping or smiling.
It's a whole new experience. Cochlear implants are very, very successful when they are implanted at a young age. So these kids that we're seeing the YouTube videos of, they are also very successful for what we call post-lingually deafened adults, which means I had hearing, I learned to speak, and then something happened to my hearing and I lost it. I have a number of my patients who have reached the point where hearing aids are no longer able to give them benefit just because of the severity of their hearing loss, and they go to a cochlear implant and they're very successful. Cochlear implants are less successful for somebody who has lived in deaf culture or been severely hearing impaired, deaf their whole life, because it's hard for their brain, it's hard for their whole physiology to kind of adapt to hearing. The world is so very different with it. And I'm not saying those people are not candidates. You hear very, very positive stories from these really young and from people who, as I said, post-lingually deaf. You hear less positive feedback from somebody who's been deaf their whole life and then do it at age 40 or age 50. So the only reason I say that is, for people like Virginia or for other folks that are maybe researching this, everything on the internet is not true. that may be a surprise to you guys, okay? Everything on News Channel 5 is true, but everything on the internet is not necessarily true. And so there are some negative things that you can read about cochlear implants, but for the most part, those are more people who had lived their whole life without that sound and then just really struggled to adapt to that world of sound, whereas the great, fantastic, positive stories are more, like I said, the young or somebody who's post-lingually deafened.
Yeah, it really makes sense once you think about it. Sure. All right, we have to take another quick break. We're going to come right back with more of your questions and comments. Stay with us.